Hi, I'm Alexandra and I'm 17 years old. I had been diagnosed with scoliosis, and the first doctor that we had seen told me that there was nothing really that we could do and that I was going to be put in a back brace, and we found out that there was physical therapy that we could do, so we began that process. So scoliosis is the curvature of the spine, and I would say the way that it affected me, I kind of had a more unique experience where I didn't really realize that anything was wrong until I was told. I wasn't really having any back pain. I never really sensed that anything was different. And then I got my x-rays back and I had scoliosis.
So scoliosis is a side-to-side curvature of the spine that measures more than 10 degrees. So in severe cases, surgical correction is recommended. But in lesser cases, typically what they'll do is they'll recommend back bracing or a combination of back bracing with scoliosis-specific physical therapy. Alexandra is so awesome, and she's really sweet, but she was also the ideal patient because she wore her back brace every day. She did her exercises on a regular basis.
She was super welcoming and super kind when I first met her. Which was really nice, especially since all of this was very new to me. I had never done any type of physical therapy. She gave me great resources of exercises that I could do at home to keep up with it, and every time I saw her, she was giving me new methods, new resources, and that was really helpful.
What this physical therapy does is it just helps them realize, hey, did you know that you like to stand with your body off to the side a little bit? And then what it does is it helps them realize, okay, this isn't the middle. What I want you to do is help you realize that, hey, if you stand up a little bit taller, you're a little bit more balanced and your posture is so much better.
The advice that I would give is to try not to be too hard on yourself. It's a lot more common than people realize, and it's something that's not talked about as much. I know that personally, I didn't know anybody else that had a back brace, but I know how easy it is to feel insecure or embarrassed, but really, people don't really care that much, and keep doing your research, find out things that work for you, and yeah, just try not to be too hard on yourself.